Motion falls. Only the mover can speak at this time. Yeah. You're a member of the branch? Well, technically it must be the branch involved, but... Sorry? Yeah, do you... But it must be moved by a member of the particular branch. Will you formally move it? If you wish to speak, come and speak. Sorry? Formally moved. Okay, thank you. We move on to motion 15 in the name of Glentees and Ardara branch, Donegal South West.
Sean Kelly, Glentees and Ardara. Ladies and gentlemen, comrades, the Irish health system is in crisis as never before. We have a government and minister intent on pursuing a distorted right-wing agenda with no thought for the poor, the elderly and chronically sick. In a time of much increased demand, they are cutting the numbers of clinical staff, extending already onerous waiting lists, closing accident and emergency departments, and depriving the people of the North West of an excellent cancer service based at Sligo General Hospital, all in the face of massive opposition. And they actually boast of how many fewer patients they will treat this year. After 10 years, the promised step-down beds have still to materialise. And we have the reprehensible policy of co-location to widen even further the divide between public and private patients. Meanwhile, more and more managers are appointed to the HSE. According to one report, there were 6 Grade 8 officials in the health service in 2000, while by 2006 it had grown to 602, with the figures for grades 5 to 7 increasing by between 106 and 124%. The Minister's response to everything seems to be to appoint another committee and set of protocols and then stand back and when things go awry, pretend that it is nothing to do with her. She meets the health professions and then ignores everything they say, whether it is the IMO demonstrating the clear correlation between patient mortality and the distance they are transported to hospital in the so-called Sheffield report, Professor Crown deploring that there are to be no centres of excellence above the line from Dublin to Galway, or my own union, the Irish Pharmacy Union, presenting plans to save much more money than she has without decimating an entire sector. The result is currently that 300 pharmacists have lost their jobs, along with 1,600 support staff. 10 pharmacies have closed, and many small pharmacies, particularly in rural Ireland, are clinging on by their fingertips. And we next have to endure the imposition of prescription charges on those least able to pay. Is there no shame from this minister? Delegates, when you consider what Dr. Noel Brown achieved for the people of this country with minuscule resources, what do you think he would say today if he could see the shambles that is the Irish Health Service? The most despicable action of all, however, was to close the cancer services at Sligo General Hospital. Please. I'm nearly finished. Patients from Inishowen and Glencolmkill now have to be bussed over bad roads all the way to Galway, to a hospital which is barely able to cope. These are weak, sick, vulnerable people, many of whom are elderly. You would not treat sick animals this way. It was entirely predictable that when Susan O'Keefe challenged Mary Harney to undertake the journey from Glencolmkill with genuine cancer patients, that she was otherwise engaged. Of course, she could have sent someone in her place if she had any interest in the lives of people in the most far-flung rural parts of the country, but no. Then there is the closure of accident and emergency departments like Monaghan, with 17 documented cases of avoidable death as a direct result. These are actions even worse than the heartless cuts imposed by Margaret Thatcher in the UK during the 1980s.
You're gone way over time.
The words of Deputy O'Keefe when he referred to the PDs as the oppressive Democrats were so true, but applied equally to his own party of Thatcherites as well, the party who have so manifestly failed the Irish people. Delegates, Labour and government must commit to the complete reversal of the changes made by this most disreputable of governments. The Irish people need a modern, efficient health service with a primary care sector developed as in other EU countries and universal health insurance with a principle that money and resources follow the patient. What we as a nation do not need is a stifling, inefficient bureaucracy that continues to swallow up money. One line. The politics of selfishness and lack of care which typify Fianna Fáil need to be cast where they and the rest of Thatcherism belong, into the dustbin of history. Delegates, I commend this motion to conference.